The Taylor Medical Group has produced an instructional series to help healthcare providers and women's care clinics to painlessly and profitably incorporate bioidentical hormone management into their practice. The series title is Hormone Replacement, a Scientific Evidence-Based Approach. This practical and enlightening instructional video series is based on the true confessions of a gynecologist as he explains his frustrations with the outcome of conventional practices in women's care and his clinical success in applying scientific models with modern diagnostic testing and hormone balancing with BHRT to manage previously misunderstood symptoms.
You know, I thought it was poppycock. I wasn't going to stoop to that level and read some of this, what I call propaganda about natural hormones. Well, my wife read it and she said, this is talking about me. She said, you need to look at this. You're a gynecologist. I want you to look at this for me. And so I started to explore it and I started to see how relevant it was. And so I started using it with my wife and she became significantly better. And I started using it with patients and I saw the dramatic improvement in them.
Dr. Taylor is a board-certified obstetrician-gynecologist and an assistant clinical professor of obstetrics and gynecology at Emory University School of Medicine. He frequently lectures across the country and is considered an expert in the area of clinical application of bioidentical hormone replacement and the use of saliva testing for hormone monitoring.
You've got to understand basic science and physiology. You've got to apply it to each individual patient. And then you need to do what is appropriate. You don't just cover up symptoms, give patients medications for the rest of their lives to give symptom relief. This is what medicine is supposed to be about.
Known as the Hormone Doctor in Atlanta, Dr. Taylor combines his exceptional training in conventional obstetrics and gynecology and his experience with alternative therapies to provide comprehensive patient-focused care. Along with his wife, Ava Bell Taylor, MD, a board-certified psychiatrist, he wrote the book, Are Your Hormones Making You Sick?
See, here's what happens, is that adrenal dysfunction may cause 10 symptoms. If you try to give the patient a drug for each symptom, she's taking 10 drugs. If you fix the adrenal gland, you give the patient some supplements for a few months to maybe a year, you restore the function of the gland, and then they don't need anything anymore. That's the beauty of it.
Hormone replacement, a scientific, evidence-based approach, is presented on the exclusive and interactive GibiDisc video CD format that is designed to play on any Windows-based computer. This unique disc has many special features. The slide bar at the bottom of the screen provides forward, reverse, stop, pause, and play control functions. The time code at the bottom right allows the viewer to establish reference points, assess the length of the segment, or review a specific procedure. A simple right click on the mouse lets you select the loop option. Looping provides continuous replay of the video segment for repetitive instruction. You'll find this program is an invaluable reference tool, more comprehensive than a workshop, yet always accessible in virtually any setting.
By understanding this and by growing and by learning, it has given me a new passion for medicine. You know, I see it in a whole new light now, and I'm trying to share this passion not only with patients, but with other physicians who I know feel like I felt prior to me learning this.
The savings in time and travel expense, the ease of reference at your discretion are value-added benefits that only video can provide.
A patient has never come back to me and said, thank you for these birth control pills. Thank you for the antidepressant. But I've had patients give me gifts, come in and tell me how much I have changed their lives, and husbands have come in and said how much I've changed their lives by helping their wives. You talk about gratification. It's incredible, and again, that's what I'm telling you. You have a new passion for medicine when you see that patients really come back and appreciate what you've done for them.